Good afternoon. In this demonstration, I will be showing you how to do a history and physical health assessment on the head, neck, and regional lymphatics. So as per the rubric, the same as for every assessment, the communication part and then the flow. I am not going to go through that. Instead, I'm going to start right on the history, so the questions. So with my client, I have established myself already, and I'm going to ask him first of all if he's had any headaches. So Mr. Jones, have you had any unusual headaches lately? How often do you have them? How long do they last? When do they start? When was the onset? Is there any particular time of the day that these headaches would start? Do they start gradually over hours, or does it work up to a day? Is it constant, or are they on and off? And so have you ever had this kind of headache before? So if they've had this headache before, then that's not unusual, but it's more unusual if they've never had this type of headache before. So the location, where do you feel it? Is it in the front of your head? Is it in the sides of your head? Behind your eyes? Does it feel like a band around your head, or in the sinus area? Or in the occipital area. So tension headaches tend to be the occipital or the frontal, or the sensation is of a band-like tightness, whereas migraines, which are more vascular, tend to be in the supraorbital or the retroorbital or frontal temporal cluster headaches. So that produces a pain around the eyes and the temples and the foreheads and the cheeks. So is your pain localized on one side, or is it all over? So with headaches, unilateral or bilateral can indicate the type of headache that it is. So and the character. So is it a throbbing headache? Is it pounding? Is it shooting, aching? Is it vice-like or constant pressure, or dull? Or is it a combination of a few of those characteristics? So typically vice-like with tension headache, and throbbing more with a migraine or a temporal arteritis. Is it mild? How would you describe your pain? Mild, moderate, or severe? So pain, as I'm sure we're all aware of with a migraine, is very severe and excruciating, like a cluster headache. So the course and duration. So what time do your headaches occur? In the morning or in the evening? Do they awaken you from sleep? How long do they last? Hours or days? Have you noted daily headaches or several within a time period? Has this been happening over the last few days, few weeks, or months, or even longer? So migraines can occur at any rate, in approximately 2 a month. So any precipitating factors? So is there anything in particular that brings your pain on, like activity or exercise? Is their work environment? Do you have more pain when you're emotionally upset? Or anxiety or alcohol? Do those types of things trigger a headache? So at this time, you could also note whether there is any signs of depression. Alcohol ingestion and daytime napping typically precipitate the cluster headaches, whereas alcohol let down after stress, menstruation, and eating chocolate or cheese precipitate the migraines. So when you have your headache, do you have any nausea or vomiting? Does your vision change at all with any bright lights? Do you have neck pain or stiffness, fever, any weakness, moodiness, stomach problems? So with nausea and vomiting and visual disturbances are associated with migraines, eye reddening and tearing, eyelid drooping, rhinorrhea and nasal congestion are more associated with cluster headaches. So anxiety and stress are associated also with tension headaches, and there could be headaches with such things as fever, meningitis, or encephalitis. So do you, Mr. Jones, do you have any other illnesses that are going on? So perhaps your client has hypertension, um, fever, hypothyroidism, or vasculitis, and those things can produce headaches as well. Mr. Jones, do you take any medications, or can you tell me what medications that you're on? So certain kinds of drugs can also precipitate headaches, like oral contraceptives, bronchodilators, alcohol. Um, yeah, just it can be a side effect of different medications. So can you tell me if there's any situations where it makes your pain worse? Like for instance on moving, or maybe on coughing, on straining or exercise? Is there a history of headaches in your family? Again, can you just tell me how often these occur? Uh, and so are they occurring closer together now, or is it always still been like every few days, or are they always the same length, or is it sometimes longer than other times? And if they were female, we could ask if their headaches appear at the same time as their menstrual period. Um, so what types of things do you do to treat your headaches, to help make them go away? Do you take anything for it? Do you go to sleep? Do you rest? Do you maybe have some water, drink something, eat something? Is there any type of massage that you do? So with migraines, people lie down to feel better, whereas cluster headaches, they need to move, even to pace the floor to feel better. So Mr. Jones, when you have these headaches, how do you cope with them? How do you manage getting your work done, or manage with your activities of daily living? So either at work or at home, and what do you need to help you cope? So the next question I'm going to ask is, do you have a history of a head injury? So different question. So Mr. Jones, so you've had a head injury. Can you tell me when that happened, and can you describe to me how that head injury happened? Were there hazardous conditions? Were you wearing a helmet? So after you had your head injury, did you feel dizzy or lightheaded? Did you black out, or did you have a seizure at all? Did you lose any sense of consciousness? And then did you fall afterwards? Were you knocked unconscious, or did you just get up and then were unconscious? Or did you fall and lose consciousness a few minutes later? So loss of consciousness before a fall may have had be related to a cardiac cause. So maybe there was a heart block or something like that caused the fall. So do you have any history of any illness? Do you have any diabetes? Any problems with your heart? Any epilepsy? Can you tell me where you hit your head, or can you show me where you hit your head? And so you were unconscious. So do you know how long you were unconscious for? Was there anyone around that witnessed this episode? Any symptoms afterwards? So headache, vomiting, any projectile vomiting? And what was your level of consciousness following? Were you dazed? Were you sleepy? Did you have a hard time staying awake? How has it been since your injury? So any change of level of consciousness is of prime importance in the evaluation of any neurological deficits. And even the projectile vomiting is another symptom too. So with this injury, this head injury, do you have any ongoing pain in your head? Did you have at the time any neck injury, or do you have a neck injury now? Same with any vision changes or did you have any discharge from your nose or ears at the time? When you had your injury, were you able to move all your extremities or just some of them? Did you have any tremors? Did you have any? Could you walk straight, or did you stagger? Any numbness or tingling in any of your limbs, in your fingertips, in your feet? And did those symptoms subside, or are they always there? Are they getting worse? Are they getting better? Do they come and go? How are those symptoms since your injury? And when you had your injury, did you go to the doctor, the hospital? Did they give you any medication for that? So my next question is, have you ever experienced any dizziness? So tell me about your dizziness, and can you describe it for me? So if a client complains of dizziness, there is a difference between dizziness and vertigo. So we want to get some information more from the patient to describe that. So did they feel like they were going to faint, and did they feel lightheaded, like a swimming sensation, feeling like they were going to fall? It could be caused by a decreased blood flow to the brain, or heart irregularity that causes that decreased cardiac output that would cause them to be dizzy. Whereas vertigo is more a sense of a rotational spin, where you feel like the whole room is spinning, and that is more caused by inner ear, so labyrinthal vestibular disorder. So we would want to ask more questions to try and distinguish it between dizziness and vertigo, to try and come up with a diagnosis. So disequilibrium is a shakiness or instability when walking. It's related to a musculoskeletal disorder or some multisensory deficits. So back to your dizziness. Did it come on suddenly, or is it gradual? And does it change when you have a change of position, or does it come on suddenly when you're standing? When you have dizziness, how long does it last? And is there anything that makes it better, or anything that makes it worse? And when you're dizzy, do you feel nauseated or feel like vomiting? Do you know if your face or your color turns white, or if you have pallor? Any immobility? How is your hearing at the time? Do you have ringing in your ears with this dizziness? Or do you have any palpitations? Do you feel anything in your heart? Do you feel like you're short of breath when you're dizzy? Next question is about neck pain. Do you have any neck pain? Does your pain limit the way you move your neck? Does it is it painful to move? Can you move your neck from side to side, up and down? And did you have what triggered this pain? Did you have any type of accident or any type of injury, maybe sports injury or something, a fall or a fever? Did that neck pain come on gradually? Does it radiate? Does it go across your shoulders, down your arm, down your back? Any other associated symptoms like numbness or tingling in your shoulders or arms when you have the pain in your neck? And what makes it better? What makes it worse? Does moving make it worse? Any onset of stiffness with the headache and the fever? So if there is any onset of headache and fever, it could mean meningeal inflammation. And so that would be one thing we would be watching for. So does your stress seem to trigger that pain? What are your coping strategies? How do you manage the neck pain? Are you still able to go to work? Are you able to sleep at night? So with pain, it can create a vicious circle, and so any tension can increase the pain and that disability, which produces more tension. So next question, do you have any lumps or swelling in your head or neck? Any recent infection, any tenderness? With that lump, does that persist? Have you had that for a long time? Has it changed in size? So any tenderness can be a sign of an infection. And if they had any lump for a while, that's been persistent, it could be a sign of something more malignant. Do you have any prior history of radiation of your head or neck or upper chest? So if they've had any radiation of the upper body, that can affect any either thyroid glands or salivary glands too. So do you have any difficulty swallowing? So so we would be noting if they have any dysphagia. Do you smoke? Do you smoke cigarettes? Do you smoke marijuana? Do you any other drugs that you do? If you smoke, how many packs a day do you smoke? Do you chew tobacco? Do you drink alcohol? How much alcohol do you drink in a day or in a week? Have you ever had a thyroid problem? And if you have, is it over-functioning or under-functioning? And has that thyroid condition been treated? So now we're ask you some questions about if you've had any surgery on your head or neck, and what type of surgery did you have? Why did you have surgery? What condition was your surgery for? What did it? What was the reason for your surgery? And how did you feel about these results? So, because any head or neck injury or surgery can have change, the sense of their body image. So, and then so that's the end of our questions. The skull. So we're looking at size and shape. So we're going to put our hands through the head all the way around the back of the head and to palpate. So looking for general size and shape. Is it round? And people's heads can be in different sizes or shapes too, but you're looking to see if it's symmetrical, or is one side the same as the other. Do they have a small size head, so microencephalopathy, or do they have a large, abnormally large head? So with again, to assess the shape of the head, you would use your fingers to palpate the scalp, and you would go through all the through the skull. So next, we're looking at any deformities, lumps or tenderness. So if we note whether the skull feels symmetrical and smooth. We note any cranial bones that have if they have any normal protrusions. We're looking at the forehead and the lateral edge of the parietal bones and the occipital bone and the mastoid process behind the ear. So we can take a look as well as feeling for it, and if we see if we can see anything unusual. And we would also ask at the same time if there's any tenderness on palpation. So looking for any lumps or depressions or any abnormal protrusions. So the next assessment would be to palpate the temporal artery or the temporomandibular joint. So that's along the cheekbone, between the eye and the top of the ear, and so we would work from the side that we are on, and we would lightly palpate that area, and so we want to make sure there's no tenderness, no bones. We can take a check for a pulse in this area as well, and we're looking at the temporomandibular joint, which is just below that temporal artery and anterior to the tragus, so in this area, and palpate that joint. Ask them, can you open your mouth and close it? And as you're doing that, you're feeling in that area to see if there's any pain or tenderness, and if it's smooth. So also we would be checking for any crepitation. You feel anything or hear anything with that motion and any tenderness. Next, we're inspecting the face, and we're looking at all the different facial features and structures, and noticing their facial expression as well, and any appropriateness for behavior or any for their mood as well. So anxiety can be common in the hospital, so just take that into consideration, and some patients might express hostility or aggression. So we're looking at their muscles, and we will also can look for any flat effect as a sign of depression. With facial symmetry, although the shape of the facial structures may be different for each ethnic group, they should still be symmetrical, so the same, each side looks the same. We're looking at the eyebrows, the symmetry of the eyebrows, and papillar fissures, looking at the nose and the sides of the mouth. So looking through the whole area, is it the same on each side? Then the symmetry of movement. So if there is any difference from one side to the other when moving, it can be a result of a central brain lesion, which like a cardiovascular accident, CVA, and that would mean, or it can be some damage to the cranial nerve 7, which could be from Bell's palsy, for example. And so we would note any abnormal features. We would look at any coarse facial features, exophthalmos, looking at the eyes, and changes in the skin color or pigmentation, or if there's any abnormal swelling. We're also looking at involuntary movements, in edema or any lesions. Is there any swelling or open areas? So sometimes people might have some sort of tics, so they have involuntary movements, facial muscle movements. So normally none occur, but so you would note whether there are any. So if there was edema, it would occur mostly around the eyes. That's called periorbital edema, and in the cheeks. And then notice if there's any grinding of the jaws or excessive blinking. So now we're going to inspect and palpate the neck. So as we're going through, the head position is midline, and we're going to check the muscles in the neck, and the head should be erect and tilt. So we can ask them to tilt their head forward and backwards. We can ask them to move their neck from side to side, and we're checking their range of motion. So are they able to move their head back and forth from side to side easily, or is there some arthritis happening? So we want to check the limitation of that movement too. Are they able to make a full turn back and forth, up and down, or not? We can ask the patient to touch their chin to their chest, or turn their head left to right. We can try to touch each ear to the shoulder, so he would go from side to side like that. We'd let him do that. I wouldn't be moving his head like that. And then see how easily it is to move their head. And when they are moving, to notice if they have any pain. Maybe they have a facial expression of pain when they're moving. And sometimes you can hear kind of crickety, ratchety noises too when they're moving. So it can be from cervical arthritis or inflammation of the neck. So because an arthritic neck can be really quite rigid. So we're going to test the muscle strength of that cranial nerve 11, and we're going to have the patients shrug their I put my hands on their shoulders, and we want them to shrug their shoulders, and I'm going to just provide a little bit of resistance, and then and then they turn their head from side to side. I'm going to provide a little bit of resistance too, just to check the strength. So I would notice as I'm doing that any enlargement in any glands, and notice any swelling maybe in the parietal area. I could look at also the thyroid, and if there's any thyroid enlargement, and checking, just checking the thyroid area. So my hands come down, palpating on each side of the trachea, and then looking for any swelling. So the thyroid enlargement can maybe a unilateral lump, or diffuse and look like a donut across the lower neck. If there's any pulsations from there, I would take my stethoscope and just listen, see if there's any bruits. So normally there isn't any other pulsations while they're in that sitting position. So the next I'm looking at is the lymph nodes, and there are 10 groups of lymph nodes, and you would start using a circular motion and light palpation with the pads of your fingers, and you're going to check for tenderness by palpating along that line. So we begin with the periauricle lymph nodes, and we work through the 10 groups, and we do them in a routine order so that we would always remember. And so if we notice that they are swollen, we're going to watch and see if they're swollen or tender to touch. And they should not be tender to touch you most often won't be able to feel them, and but you're looking to see whether there is anything there. So we start with the periauricle, and that's here, and then we go to the posterior auricle and light palpation, and then we go to the occipital, which is still behind the ear, further back, and then we start with the submental. We would feel there, and then we would go to the supramandibular on each side, and then we would go to the submandibular. Stop for a second. And just a little bit further back is the tonsillar lymph nodes, and then just below that, along the neck line, is the superficial cervical, and then down more lower here is the deep cervical chain, and we also have posterior cervical lymph nodes, and then the supraclavicular are more down here. So those are your 10 spots. 2, 3, 4, 5, 6, then 7, 8, 9, and 10. So there's a chain that goes through here. So after as I said, you would establish your sequence, and that's how you are checking them. And you're looking at their location, their size, their shape, and whether they're tender or not tender. If you do have some tenderness or swelling, it could mean an infection, and you're watching also for any signs and cold symptoms or any fever. And you want to know if they're swollen, if they realize they were swollen, and how long they have been there. Is it warm and tender, or are they firm? There might be some chronic inflammation that causes the nodes to be swollen and clumped together. There could be some cancerous nodes too, as well. So once you're done looking at the assessing all the lymph nodes, then we can auscultate the thyroid. So that it's difficult to palpate, so you want them to position. You might sometimes you could use a light if you have a hard time seeing to shine across the neck to see whether there's any possible swelling. You could give them a glass of water, ask them to swallow that water, and inspect the neck as they swallow to see if it moves up with the swallow. If that thyroid gland you find is enlarged, then you can also auscultate it, as I said before, with your stethoscope. And you would use so there should be if there is a bruit, it would be a soft, pulsating, swooshing, blowing sound, and it's best heard with the bell of the stethoscope. So you're also going to be looking for any other signs like bulging eyes, a goiter, which is thickness around the neck, and you're going to ask, see if they have any fatigue or weight loss or nervousness that might relate to any thyroid conditions as well. Then the next thing to look at is just the trachea, making sure that it is midline, and you can place your index on the trachea and the sternal notch, slip it off to each side, and the space should be symmetrical on both sides. So then if it isn't, then there could mean different conditions that that might occur because of that. So related to maybe an aortic aneurysm, or could be something to do with a thyroid lobe or a pneumothorax. So that's the end of our physical assessment, the end of our assessment for the lymph nodes, the head, neck, and regional lymphatics health history.